Hi, welcome to Dr. Hennessy's podcast. This is part 3. My favourite treatment that you do on me, and there's quite a bit of treatment I might have, is my cheeks.
Cheekbones, yeah.
But I don't have it here,
No,
but I have lateral
yeah.
cheekbones. But yet, I do have, the lines are getting deeper. So does this mean the fat pads are just coming down now here? Because if I had stuff here, it wouldn't look right.
No, it looks too much in some people. That's the thing. And then that's the thing. Some people, you have to say, you're going to have to put up with those lines because you've got the full. We had a lady the other day. She was really full here with the cheeks, but had these deep lines. And you go, there's not a lot you can do because if I fill those and you've got full cheeks, you're going to look weird. You're better off just having a bit of lines. But that takes us back to the original thing. It's not going to be a case of erasing every line, making you trying to look 21 again. It's a case of making you look well for your age, which doesn't mean getting rid of every single little line that you have. So you can have those softened. Your lateral cheeks is nice, again, because that's more of a structural thing, isn't it? To lift and define. And that's a lot of women don't often need it here, but you'll have it at the sides to give you some definition.
I think it's a contour as well.
Yeah.
I think
so men can get away with that as well because men don't need it full here. Men are flatter here. Mine's fat as well, you know. But they will have it flatter here and more defined there. And that looks better on a man. But a woman needs it fuller at the front.
Needs the apple as well.
Yeah, yeah.
Oh, okay. I thought it was different because I think it's very feminine to have the cheekbones.
It is.
So if I see somebody going in to see you and when they come out and see me afterwards, I can see the cheekbones and I think the contour of the face is so feminine. And I wouldn't have said that's what a man would need. It's
the men have less and it's lower down. So the cheekbones on a woman will be quite high. A man, you would actually put a little bit lower down. If you study sort of faces, you can see that a man, if he looks good, there's a little bit of cheekbone showing here, not at the front.
Looking at a man's photograph, I'm only
you can studying. Say you're studying for work.
Yes. It was around 30. Yeah. I'm just studying it for work. Okay, I didn't know that. So you won't put anything here. You're just
generally no. With men, you've got to keep that pretty flat.
You see, they look okay with the nasal labials. It doesn't change their.
You have more of a. This is the thing. A man can look more athletic because it's masculine look. A woman, without being awful, doesn't necessarily want an athletic look, do they? We don't get women coming in going, I want to look like an athlete, because that would then tip you to thinking you're more masculine looking. And that is when you have less fat in the face. So you can get away with a nose to mouth line just through a little bit of aging, a bit more rugged, if you like, as well. You have less fat here, but a nice little sort of definition here.
So when you filling the nasal, we seem to be on the nasal labials, but that might be so I'm putting it subconsciously for me. Do you use a certain type of filler?
Yeah, it depends. So you would either use something, I would use something a bit softer. You've got to use something. When your lips, nasolabials, marionettes as we call them, you want a filler that's mobile, don't you? You don't want something that's stiff. So that as you're talking, because you look in the mirror yourself and you'll go, oh, okay, yeah, I need those filling. And you don't talk to yourself in the mirror. What we often say to patients is talk to yourself in the mirror. It sounds a bit strange, but talk to yourself in the mirror because that's the way you are perceived by the Joe public.
But surely the filler isn't
so
that
you need something
stiff,
soft.
Is it?
Some can be. Some can be quite firm that when you're animating, this stuff is like a bit firm. But that's when it's been put in the wrong spot. That firm filler on a cheekbone or a chin is amazing. There's one called Lift, which, funnily enough, does what it says. It kind of lifts because, that's another point we need to talk about, isn't it? Because everyone, I'm whittering on now, but everyone says filler doesn't lift. You started it. Filler doesn't lift. There's a whole backlash now. Now, okay, I get filler is not surgery. Filler doesn't physically lift. But when you do cheekbones, and I refer to the cheekbones as like the coat hangers of the face, don't I? So that when you've put filler in the cheekbones, you do get some lift. Patients see that the jowls have lessened, the corners of the mouth have lifted. You do get some lift with filler.
You have to because it's coming out slightly.
Yeah, exactly. It comes out slightly, so it's going to pull up slightly. But there's a whole backlash now over, and I see, fillers don't lift. Don't tell your patients that fillers lift.
We've had some of that on our
I think
social media.
It does a little bit. It's not surgery. We never said it is surgery. But yeah, we see it, don't we?
So to get some lift, which is what everybody wants, over 40.
Like everybody knew. I just want that. I had a lady the other day. I just that.
Yeah, but it makes such a difference.
It does. And if there was a little thing you could do that was just going to do that, yeah.
So you can't if I've got my cheeks, there's nothing else that you could.
So okay, you can get subtle lift. You can get that. So with some of the newer procedures, so one, go back to your normal fillers behind it. There's an imaginary. It's not an imaginary line, an anatomical line, shall I say, called the line of ligaments that runs sort of like that, pretty much cutting the side of the face in half. If you inject behind that line of ligaments, the skin and everything else is more taut, if you like. It's more stuck down. So when you fill here, you do get more of a lift. When you fill in front of that line, you're getting more volume. And this is where a lot of these celebrity, I think, people have been overfilled, because they've filled at the front thinking it's going to lift, it's going to lift. It's going to volumize at the front. It's going to lift behind there. So using the appropriate filler behind this line, or you can use the new stuff called Sculptra, which stimulates your own collagen. That sort of stimulates over a number of weeks. Well, that will produce collagen here, and again give some tight and lifting.
But you can't actually do. I mean, where do you do it? Because I know that you've got an artery, your nerves,
salivary gland back here, muscles. So a lot of it will be superficial, or then some of it is going to be onto the main cheekbone on the jaw. The main bone on the jaw. Yeah,
death becomes it by the time you finish.
The main bone here, the main bone on the cheek. So you can fill onto bone there, which everyone always cringes about that, but it's actually the safer area to go. And you are sort of replenishing bone, if you like. So if you've lost support here, you go onto bone, you will fill there, and then everywhere else is generally more superficial in the skin to sort of keep it safe. And those two things can help produce a bit of lift.
Okay. Do you do that? What age group would you say that's on?
40s. Let's say about 40s. Most people below that age don't really need that sort of I'm not saying invasive, or that sort of amount, or that's the sort of next level up, really doing that back there to give it some lift. I think in your 30s you're just more subtle and a bit of prevention than 40s or 90s.
40s. You can stop at 40s. Early 40s. Thanks for watching us. If there's anything you would like us to cover or any other information, just leave it in the comments or message us and we will do it for you.